to today's episode of Unplugged by Shape America. I'm your host, Stephanie Morris, and today my special guest is Carly Wright, our Vice President for Equity, Diversity, and Inclusion and Advocacy at Shape America. Carly, thank you so much for joining us today.
Thank you for having me. I'm thrilled to be here.
So to get us started, there is so much happening right now between protests to advance racial equity and the critical work you're doing with the CDC on our national school reentry considerations for teaching health and physical education. There is a lot going on in your world, it is fair to say. So I think our community will want to know, how are you, Carly Wright, doing?
Thank you for asking. Yes, there's a lot of very hard and emotional, but incredibly important things that are happening in our country right now. And so I think, both personally and professionally, I'm trying to find new ways to contribute to all of this, but also to recognize new ways to prioritize self-care and to just really, find that time to slow down and breathe and really this has provided me the opportunity to really focus on family first. So I'm thankful for that.
That's fantastic. I'm so glad to hear it. So tell me a little bit about the intensive process that you and your colleague, Michelle Carter, Shape America's Director of Educational Programs and Resources, undertook to create the School Reentry Considerations.
Sure, absolutely. Well, as the COVID-19 pandemic began, immediately schools looked very different, and it was really just about shifting in an emergency in that moment and finding ways to support students and to quickly figure out how to teach during a pandemic. We knew from there that back to school in the fall was likely to look very different, and that as an organization, Shape America needed to figure out how we can support our educators and support schools in the best way possible to ensure that health and physical education were really an essential part of any school reopening plans. And during a global health pandemic, we believe and know that it's now more important maybe than ever to focus on health education, and physical activity. So as we started on this process to figure out what these recommendations and considerations would look like to help schools through this process, it really began with our great partnership that we have with the CDC School Health Branch. And we're very fortunate to work really closely with that group who's been integral in working with the CDC's COVID-19 mitigation and response team to ensure that schools are prepared and have as much guidance as they need to provide safe learning environments for students, as well as for teachers and school staff. So it really began with working with CDC to read the guidelines that they put out for schools broadly. Because of our partnership, we had great opportunities to engage in webinars, stakeholder calls, to communicate directly with that COVID-19 response team at CDC, to be able to ask questions specific to scenarios that health and physical educators would have. So we're very fortunate to have that relationship and to have that access to really start thinking about what school would look like for health and PE from there. Then, of course, we started to research reentry guidance from other organizations in different fields that may impact us, as well as look at what other countries who have already reopened their schools, what they have done and how they have moved forward with offering opportunities for health, physical education, and physical activity. From there, it was, of course, incredibly important for us to reach out to the field and to get feedback from the community, and to hear from our teachers, what were their concerns? What were the topics and areas that they need the most guidance and support and resources about? So we worked closely with our state and district health and physical education leaders, special interest group, of course, to have some really deep conversations in town halls about what they need in their leadership roles within their states and school districts, We've done focus groups with a lot of Shape America leaders leading up to this, as well as launched a national survey open to both members and just the community at large. Again, really just to get a good understanding of what our field needed from us in the way of guidance and considerations. And then, of course, everything that we were recommending in our school reentry considerations guidance is really founded in our national guidance and framework for health, PE, and physical activity. So we took all of that, and then Michelle and I really just began writing. And as we began writing, a lot of things sort of uncovered themselves as maybe increased priorities during this time, and how different things are going to look when schools reopen because of COVID-19. And so a couple of things that really came to the forefront as priorities for us were things like equity, inclusion, and accessibility, ensuring that all students have the same access to learning, no matter if that means in person with physical distancing or a distance virtual learning environment. We need to find ways to be able to serve all students, including students who don't have access to technology and students with disabilities, right? Social emotional learning, which is something that our health and PE teachers champion always, is really going to be more important now than ever. Things like trauma sensitive learning environments, of course, are going to be incredibly important as students have experienced all, variety of feelings and emotions, whether they've been sick and impacted or their families have. We need to be prepared to support students in what that looks like in the fall. So that really came to the forefront for us, the importance of building those connections, building those relationships with students in this very different model of learning is really going to be paramount to anything else. Finding ways to support them through those complex emotions of things like stress, anxiety, and grief that are brought on by the COVID-19 pandemic. And really health and PE teachers are poised perfectly to be able to provide those type of supports to students.
Thank you, Carly. So was there anything that surprised you in particular as you went through this process?
Yeah, that's a great question. I think, we knew this was going to be a complex situation and a complex document, but I don't think we knew how complex. I mean, the process of reopening schools, there's so much uncertainty around, this COVID-19 pandemic, and it makes it challenging because you don't really know what to plan for. So we have to plan for all possibilities. And, things will look different from state to state and even from school to school in how schools are delivering learning to students. And so we really had to think through all of those different possibilities and be really thoughtful and detailed to ensure that we were addressing everything that we could think of that will specifically be in the purview of health and physical educators, and how things will look different and how they can best adapt to this different learning environment to be able to best support their students. I think we're also still learning a lot about these equity challenges of distance learning and how hard of a shift that was, and how important it is to support all students, no matter what the model of learning is. If students are at home, do they have a safe space to be physically active? Those are all the types of things we need to be thinking about as educators. And it really goes back to finding ways in that virtual setting or in that in-person setting where maybe we don't have the chance to be as close physically as we have been in the past, to make those connections with students, to really understand their unique situations that they're facing. The other thing I think that came up as something that was incredibly important is how hard and stressful this has been on our teachers. I think this pandemic has reminded us of the superpowers that teachers have and the lengths they're willing to go to support their students. But that level of commitment doesn't come without real effects on teachers' levels of stress and their mental health. So just really remembering that we all have to support each other and find ways to build community as a network of health and physical educators. The last thing I'll just say that was really important as we were drafting all of this is, this is a process. This things related to COVID-19 are fast moving and changing. And so we know that this is going to have to be a living document, and that as CDC guidance evolves, as the situation around COVID-19 evolves, we'll definitely intend to update our considerations as well.
Thank you. Really insightful to hear about how you undertook a very thoughtful, inclusive process with all of this. So once the considerations are launched, what happens next?
A lot. This is really just the beginning for us, these considerations. This considerations document, we're really looking at that as the framework of how we develop really a suite of resources and supports for our teachers from there. So we'll really, continue our work with the CDC, especially over this next school year, to develop additional instructional resources, videos, activities, and a lot of virtual professional development. We want to make sure that within this new framework that we're presenting, teachers have the resources that they need to still learn how to teach effectively. And so we will be taking some deep dives into some particular areas to provide teachers with some resources to support them further. So specifically, we'll be looking at supporting geographical areas that were most impacted by COVID-19, as well as particular populations that may have been impacted more than others by COVID-19. And we'll be looking to provide a number of different professional development resources that will focus on things like equity, diversity, and inclusion, trauma-informed practices, SEL, and self-care, all of those priorities that really emerged as Michelle and I were collecting information and writing this document. We'll also be working in close partnership with national associations for school leaders and administrators like AASA, CCSSO, and organizations that are committed to health and racial equity, like the National Urban League, NAACP, Rural Health Foundation, groups like that. We'll be there to really help guide our work and to ensure that very strong focus on equity. Additionally, we're working with Kaiser Permanente, a healthcare company, to contribute to their school reopening playbook. And the audience of that playbook particularly is school district administrators. And so we've been able to contribute a chapter related to physical activity and physical education within the Kaiser school reopening playbook, just to ensure that our guidance, our priority that we're putting on the importance of health, PE, and physical activity in school reopening really reaches a broader audience that way. So we're thrilled about a lot of what is ahead.
That's fantastic. It sounds like there is just a plethora of professional development resources coming together, and it's really great to hear about the Kaiser Permanente School Reentry playbook as well. So I know that also all of this will serve as the foundation for a comprehensive advocacy effort to help school districts, administrators, families understand that now more than ever, physical education and health education are essential components of a child's education and well-being. Can you talk to us a little bit about the advocacy effort coming together to support all of that?
Yep, absolutely. So really these school reentry considerations were, again, kind of that first step in that advocacy process. Our first step was releasing these school reentry considerations. So with this document, we can show schools, show administrators, again, how health and PE can be done safely. And so now we can really talk about why they're absolutely integral to any school reopening plan. We know that this next school year is going to be incredibly challenging, from budgets to adaptations that will have to happen because of COVID-19, but it's critical that as a community, we come together around that one unified message when we're speaking with school administrators, that the well-being of your students begins with health and PE teachers. And we have to be prepared as a community of educators to adapt and to change what health and PE programs look like in the fall. You know, all subject areas are going to have to adapt, and we're no different. And I know that's a little bit scary, and it's challenging, and it's maybe not ideal, but it's critical that we are part of that process. And it's so important that we lead with how we can help our schools and help our students. And so everything that we create around our advocacy messaging will really be focused on that during this global health crisis, health and physical educators are the ones that are best equipped to help students develop those necessary skills, those health skills that they need to cope and manage through all of this, right? And so that will be our message. And we're working now with a coalition of education organizations on the national level to advocate for additional COVID-19 bailout funding for schools, because we know schools will need more money to support this new model of learning. And we are your voice on Capitol Hill to make sure that that's happening. On the state and local level, we know that sharing these unified messages are critical as well. So right now we're working to bring together our community on the state level and working with our state affiliate advocacy chairs to bring them together in community on a Facebook group so that they have a place to share ideas, to help each other as we're getting these advocacy messages out to the right stakeholders and the right groups. And we'll use that group as a way to convene a virtual state and local advocacy day this summer. We know these messages will be critical to be getting out to parents, getting out to students, engaging with school communities, engaging with school administrators all summer and then all year long. But we plan to have that one day where we'll all come together as a community to really share this national unified message around the importance of health and physical education, and that when it comes to the well-being of your students, the health and physical educator is where schools and administrators should begin. So we'll convene that virtual advocacy day this summer and are just looking forward to really rally together and find new and innovative ways, as our community always does, to be able to support students the best way that they can. And, you know, as I mentioned before, these efforts are going to be ongoing, and things are changing. This is a fast moving situation, and we're just prepared to pivot as we need to along the way and shift and change and adapt and be flexible, as our educators will have to do in the fall as well, to provide you with as much guidance, resources, professional development, and advocacy support as we can.
Fantastic. Thank you again so very much, Carly, for spending some time with us today to talk about the school reentry considerations that are about to come out and the advocacy effort that will be such a pivotal part of all of this. Any last words for our community, Carly?
Just thank you for all that you're doing, and we are absolutely 100% here to support you. We want to hear from you and the unique situations and experiences that you're having through all of this. You know, we're working hard to respond to the needs of the field, and we are here to have your back as always.
Thank you. Thank you again, Carly, for being our guest. And thank you, everybody, for tuning in to today's episode of Unplugged by Shape America. Again, I'm your host, Stephanie Morris, and we hope that you will continue to tune in. Thank you.